I'm Lacey.
And I'm Katie.
And today we're going to be doing a demonstration on our IPL, or our Intense Pulse Light machine. This is used for our photofacials, or IPL photofacial. That is going to be on special in December. We do have limited availability due to the holidays. We're going to be closed the end of December. So if you want to get in for the facial, we want to give you the information way ahead of time so that you can call and get scheduled. Do you want to tell us a little bit about the machine?
Yes, so this is actually the same machine that we would be using for dark spot removal. If you have broken blood vessels, we treat rosacea, laser hair removal, which that's typically what it's called, is a laser hair removal, but this is actually not a laser. So it's like Lacey described earlier, it's the IPL. So a lot of people will say laser hair removal. It's actually just the IPL machine that we're using for that. So you can treat a lot of different issues. Like I said, the rosacea, you can treat uneven skin tone. It's good for skin rejuvenation. You can treat oversized pores with it as well. A lot of people use it just for radiant and glowing skin. So the best time to use it is in the fall and winter, so right now, and that is because it can interact with the sunlight or UV rays if you're somebody who uses the tanning bed. So it's best to get in during that time where you're not going to be out in the sun for 2 weeks prior and 2 weeks after your treatment. So it's really important that you stay out of the sunlight for that amount of time. You also want to make sure that you're not using a retinol, also known as Retin-A or tretinoin. If you're one of those users, you don't want to use it. You want to stop using it 1 week prior to your treatment, and 2 weeks after your treatment, you also don't want to be using that. And again, that's just, just to keep it safe for you so that you're not blistering or having a bad reaction to it. So something really good about the IPL, which I just learned recently, is that it also boosts the collagen production, so it's good for fine lines and wrinkles as well. It's good for most skin types. Most people are good candidates for the IPL, so if you do have any concerns with whether or not you're a good candidate, you can always just give us a call or have a consultation with us. But we'd like to show you guys kind of what it looks like when we go through a demonstration. So we're going to take a break in just a moment and get our beautiful model in here so we can show you what it looks like.
We first begin with cleansing the skin. Now, the skin needs to be cleansed of any dirt, debris, makeup. Part of the way that the IPL works is that it targets what we call a chromophore, which is a color within the skin. So if we have any kind of dirt or debris, it could target that. Then she applies these little lead eye shields. This is going to protect the retinas from any of the light. She applies an ultrasonic conductive gel that'll help the light penetrate into those deeper tissues, and then she starts marching the machine over the skin. Typically we're wanting 2 passes in each area. This is going to give us more adequate coverage and make sure that we have covered all of the areas and make sure that everything is taken care of. Now, as you can see here, the skin is a little flushed, but my skin tends to get a little red with just about any kind of rubbing on it. But it's no downtime, truly. I went right back to work afterwards and I wasn't even red. You won't have any peeling or anything like that. Now, with the dark spots, usually the dark spots will get a little bit darker for a couple days, kind of like a coffee ground substance, and then they just kind of fall off. Now, the red spots or any kind of rosacea might get a little bit more red or a purple color, and then they disappear. Afterwards, she cleanses the skin. Again, you can see it's not really red. There's no blistering. After she cleanses it, we're going to put on an ice mask. The ice mask is just going to help kind of cool the skin down. Typically, the ice mask sits on the skin for about 5 minutes before we remove it. Now, after she removes it, she'll start to apply some serums and sunscreen and remind me of my to-do list.